Let's bring in our next guest, Christine Holt from Amdal In Home Care. Christine, hello. How are you?
Good. How are you doing?
Good. What's going on in the in-home care world these days?
Oh, we've been really busy this week. We've been doing Virtual Dementia Tours, which I think you're familiar with.
I've done one. It's amazing.
Yeah. So what it is, for those of you that don't know, it's basically a simulation, and we put people into situations where we simulate vision degeneration and just confusion, and we have shoe inserts that simulate like nerve damage and things like that. So we're able to usually we work with our family members of our clients so that they're able to understand what their family members are going through. But we put them through a tour, we give them tasks to complete, and as you know, it can be very difficult to complete those tasks, but it's great and it's eye-opening for caregivers. So
it's frustrating for the family, I would imagine.
It is, absolutely.
And it's frustrating for the affected too, because no one wants to get like that. And when they start getting like that, they don't want to. I think sometimes they probably hold it back, and they're like, "Oh man, my vision isn't going so good lately." But if I tell somebody, they might take away my driving privileges, and I don't want that to happen.
Right. There's a lot of different stages to it, definitely, and everybody is affected in a family, so it's just.
Where are you giving these virtual tours?
We offer them in our office, and they're free classes to anybody that would like to. We open it up to the whole community because, I mean, really, education is key to everything. If you want to understand what that person's going through, give us a call. We'd love to have you in the office and put you through the class. And
Nate, do you know much about dementia?
A little bit. I've experienced a little bit in older members of my family.
Okay.
Yeah.
Why don't you tell Nate a little bit more about the virtual dementia tour?
Yeah, absolutely. So like I was saying, we simulate different symptoms of aging, essentially. One of the things that we put on is a headset that has a lot of just confusing noises and things like that, because when we have people that are encountering dementia or starting the early processes, they can't focus on a certain noise. So say, for instance, your family member has dementia and you're giving them instructions, there's laundry on the table, can you please fold it and put it away? All they hear is the air conditioning running in the background, the cars driving down the street, and things like that. They're not able to differentiate between what you're telling them and the noises and distractions that are in the world going on around them. So we simulate that with the headset. We also, like I said, have the shoe inserts that simulate the nerve damage that some people can encounter over the years. We have goggles that simulate macular degeneration, so just the loss of vision over time, and then also the loss of peripheral vision, so it blocks off the sides. And then I give you a list of tasks. Sounds like fun, right? I'm going to torture you for 10 minutes. But
it doesn't sound like it's that tough. But and even when you first put the things on, it doesn't seem like it's going to be that tough. But when the tasks, the buttoning of a shirt or something can just drive you mad.
Yeah, we've had people that have panic attacks in the middle of it just because you don't know how to process the information that's being given to you, and then you don't know how to get through the task, and it's frustrating, to say the least.
I have never heard of this being done before, and I think it sounds amazing.
It's incredible.
And so valuable.
Yeah.
I mean,
absolutely.
like you said, education is key, and so it's valuable to everybody all the way around, maybe even people who aren't experiencing this in their life at this point.
Right.
It can give them a better understanding and compassion towards others.
Absolutely.
How did you become involved in this?
Well, I've worked with Amdal In Home Care, and we specialize in the care of elderly, and a lot of times that's people with dementia and Alzheimer's. So through working with them, our CEO, she's an RN, and she was trained through the course, or had encountered the course somewhere, and so we just thought, as a group, I think that it would be amazing to introduce this not only to our caregivers to make sure that they're able to react appropriately to their clients, but also just open it to the community. Like I said, it's awareness and education is just so important when it comes to things like this. So.
Wow.
Talk about some of the other things that Amdal does.
As far
because it's not just people with dementia. I mean, what other kind of people do you help?
Oh, we help all the way across the board. So post-operative people, if you have surgery and you're going home, you don't have anybody there to care for you. I mean, even like myself personally, I just had an operation and I have an infant at home. I couldn't lift up more than 10 pounds, so I was kind of stuck in a situation where I needed help in the home. So I mean, situations like that, we're able to help post-operative care. we're able to help people with workers' comp cases. If you have a back injury or neck injury or things like that, basic things like folding laundry or carrying it to the washing machine become almost impossible. So we're able to help people with very minor things as well as the very severe things. So
is this covered by insurance?
It is covered by long-term care insurance. Workers' comp does generally cover it if it's part of the care. It depends on how they set that up, but also veterans benefits cover it. So there's a lot of different routes that we can go, and again, we are contracted with Valley Caregiver Resource Center for people that can't afford hours. Sometimes they're able to work with them and give them free hours through the city or the county. I guess it would be through Fresno County. So
did you say the virtual dementia tours, though, are those free?
Those are
did
free.
You see?
Yeah,
Oh,
those are
wow.
absolutely free. Again, it's open
Great.
to public. You just call to set it up. We can usually get we like to have medium-sized groups because the discussion that we have afterwards is just much more beneficial if you have more people there to talk. So
Where's your office?
we are at 4848 North First Street. So right across the street from Forever 21 Fashion Fair.
Mm-hmm.
So First and Shaw.
Okay, and what's the phone number if people want to call up and do the virtual dementia tour?
Yeah, absolutely. It is 559-227-1701.
Very cool. I think it's very, very cool what you guys do here
Yes.
in the Valley.
Yeah, it's awesome. We enjoy
Amdal In Home Care. Christine Holt, thank you for coming by.
Thank you.
We're going to take a quick commercial break. We'll be right back on The Buzz. Stick around.